Hello friends, welcome to my channel Doctor Online 24/7. Today's topic is fractures. A fracture is a medical term for a broken bone. It is a medical condition characterized by a partial or complete break in the continuity of the bone. Most human bones are strong and can generally withstand strong impact or forces. However, bones break when the pressure or force applied to them is more than what they can normally withstand, or if there is something wrong with them. Bones are the skeleton of the body that allows us to interact with our environment. They act as attachment points for muscles which allow for running, jumping, sitting, kneeling, grasping, and lifting. As we age, the bones become brittle and the force they can handle or withstand reduces. This increases the risk of fracture. Immediate medical care is needed after a bone is fractured, as serious fractures can have severe complications if not treated immediately. Complications of fracture. Complications include damage to the blood vessels and infections of the bone or surrounding tissue. Types of fractures. Traumatic fracture. This type of fracture is sustained from a trauma, such as fractures due to a fall, accident, fight, etc. Pathologic fracture. This type is as a result of an underlying condition or disease that has already weakened the bone, such as cancer or osteoporosis. Closed fracture. It is also a simple fracture. In a closed fracture, the broken bone does not break the underlying skin. Open fracture. In this type, the broken bone tears the skin and may thus expose the bone to contamination. With an open fracture, there is a high risk of infection. Transverse fracture. A fracture where the break is in a straight line across the bone. Spiral fracture. A fracture where at least one part of the bone has been twisted. Oblique fracture. A fracture where the break is diagonal across the bone. Impacted fracture. A fracture where one fragment of bone goes into another bone. Fragments are driven into each other. Avulsion fracture. A fracture where a fragment of bone is separated or pulled off by a ligament or tendon. Complete fracture. A fracture in which the bone breaks completely. Types of complete fractures are: common neutered fracture. Bone fragments breaks into 3 or more pieces. Single fracture. Bone fragment breaks in one place into 2 pieces. Non-displaced fracture. Bone fragments breaks into pieces and stay in their normal alignment. Displaced fracture. Bone fragment breaks into pieces that shift off their normal alignment. Incomplete fracture. The bone doesn't break completely. Incomplete fractures are more common in children whose bone are softer and more elastic. Types of incomplete fractures are: green stick fracture. The bone partly fractures on one side, while the rest of the bone is bent. Hairline fracture. A partial fracture of the bone, usually in a thin crack. Torus or buccal fracture. The bone is broken on one side and a bump or raised buccal grows on the other side. Causes of fractures. Falls, direct blows or strikes to the body, injuries from sports, osteoporosis, repetitive forces, caused by running, automobile accidents. Risk factors may include being old, smoking, alcoholism, use of corticosteroids, being physically inactive. Symptoms of fractures. Intense pain in the site of the injury, swelling, bruising, and redness in the injured area. deformity in the injured area, difficulty moving or supporting the weight with the affected area. Diagnosis of fractures. The doctor will ask about symptoms, examine the injury, and look for other injuries that may have occurred. X-rays are the most common method of diagnosing a fracture that help in visualizing the bone and revealing breaks and other signs of damage, as well as in determining the location and type of the fracture. In cases where X-ray alone is insufficient, CT scan, or MRI, may be used. Treatment of fractures. Treatment options depend on the type and location of the fracture. The first goal of treatment is to try to put the broken pieces back into their proper position and stabilize them as they heal. Pieces of broken bone should be kept immobile until they are mended. A cast may be used to stabilize the broken bone. The cast may be made of fiber or glass, and it will help stabilize the injured area and keep broken pieces compact until they heal. Complex injuries may require surgery. Homeopathic treatment of fractures. Symphytum officinale is the best homeopathic solution for treating fractures. This homeopathic cure helps in joining the cracked bone proficiently. Fractures, where patients complain of a prickling pain in the fractured area, can be significantly soothed by giving this regular homeopathic treatment. This is all about fracture. Hope this video is beneficial for you. Thanks for watching my video. Don't forget to like, share and subscribe my channel.